It's an occupation that allows you an opportunity to help people in a way that alleviate the scourge of pain and help them get back, whether it's to their activities of daily living or even going back to their job duties. When I went through school, it was a rigorous program, but you have a number of practical situations throughout the 2.5 years that you're here, as well as your clinical experience. You're out in a clinical setting, and as you felt you gained more experience and you're more comfortable handling patients, I always felt that it moved along the right way. So I felt very well prepared. The program itself, when I got here, I found it to be what one of our instructors called a spiraling program. What you learn in the beginning, everything is building upon what you learned previously. And each time, as they would say, you're adding more and more tools to your toolbox. So the first quarter that we were here, you have your general science courses. We had anatomy, which took up a bulk of our time. We also had following around a clinical instructor, and so you were out there and were able to observe and see what was going on. I think it was the second quarter that we got into our eval course, and that's where you're going to start learning your orthopedic assessments. You're going to start doing your musculoskeletal evaluations. Really, most importantly, just having your hands on another person. 143 degrees. One thing that I find that really helped is that it was really, I think, beneficial in my part to be able to have courses with like physician's assistants and courses with occupational therapists, because you had an understanding of what their area of expertise is going to be. And not only that, I just think it allows you the opportunity to work with individuals from other disciplines, and that's what you're doing on a daily basis out in the real world. Phenomenal faculty. They were great. Very well organized, very knowledgeable in terms of what they were presenting the students with, willing to help and work with students. I thought that they were all very strong in their areas of specialty that they taught. You had their phone number the first day of class. It was in their syllabus. And they all said, if you need to contact me, get a hold of me, give me a call. The other thing that we found was there was always an open door policy. They were always more than happy to meet with you. It's a rigorous schedule, and I think there was an awful lot of material crammed into those 2.5 years. But I enjoyed it. It was neat if you had a class that you really enjoyed, and here you were, and you were studying that material, and it was material that you were really excited about, and you're taking that in, and it's something that, again, you're able to use, or that you might be able to use on a patient someday. I think that the campus is a beautiful campus, and I think it does allow students an opportunity to take a breath or get away for a minute. PT students got together and played. There was a strong flag football program. There's a soccer players. It's a volleyball program. So if you needed an outlet, there was definitely areas to do that. Board exams, sure, they're tough. But I think that at the same time, the foundation that I had from Midwestern really prepared me well and allowed me the knowledge to know where I had to go to study. If you are ready and you prepare yourself, you should be able to pass that exam. I would tell anybody that I think it's a very rigorous program. It was designed to really make you work hard, and you're gonna have to work to get through it. But when you get out, you know that you're gonna be able to do whatever it is you want to do. You're gonna be able to treat whatever patient you want to treat. And I think that it was a phenomenal program.